I'm Fiona Lynch and I'm a specialist pharmacist here at the National Aspergillosis Centre. So yes, antifungal drugs are complicated, and I'm just going to talk about some of the reasons why and some of the things that we put in place to make the drugs safer. So Chris has briefly mentioned the treatments available. So there's three classes of antifungals, but three different types of antifungal routes that we would use. So we have the oral azoles, which are also available intravenously for patients unable to have tablets orally. So these are itraconazole, voriconazole, posaconazole, and isavuconazole. And then there's the intravenous antifungals, which are only available intravenously. So there's two classes. There's the echinocandins and amphotericin B. And for the IV use of amphotericin B, we always use AmBisome. We also use nebulized antifungals sometimes for ABPA and SAFs in patients unable to have orals, and that would be amphotericin B, but the formulation we use is different for the nebulized as opposed to for intravenous. So dosing. So I'm just now going to talk about some of the complications of antifungals. So dosing can be quite difficult for some of the antifungals. So for the oral azoles, we have a standard starting dose that we'd use for patients. But then with these drugs, dose adjustments need to be made and the dose needs to be individualized for the patient. We have to reduce the dose if you have a low body weight. If there's any known liver impairment, we may reduce the dose. Or if you're on certain other medications, we may reduce the dose. We'll also look at whether you've tolerated antifungal therapy in the past. And if you've had side effects previously, we may start with lower doses and then increase gradually depending how you tolerate it. So it's all very individualized to the patient. With the IV antifungals, so micafungin is the one we use generally in CPA. That dose needs to be reduced if you've got a low body weight. For amphotericin B, the dosing must be based by weight. And as I said, we always use AmBisome when we're giving it IV, and it's very important that it's prescribed by the brand name, because if the wrong brand is given incorrectly, the dose is completely different and it can lead to patient harm if the wrong brand is given, because the doses are very different. So Lily mentioned that we always do therapeutic drug monitoring for the azole antifungals. And the reason for that is because they have what we call a narrow therapeutic index, or narrow therapeutic window. And what that basically means is that there's a very tight margin that we have, so a very tight range that we have that, for the drug to be effective. So if it's below that range, then it's going to be subtherapeutic and the drug won't be effective. And there's a risk that you could develop resistance. And anything above that range can cause side effects and toxicity. So lots of drugs that we use have a very wide therapeutic window, so it doesn't really matter. So one dose will be right for a lot of patients, and the drug you'll give it at a standard dose and it's likely to be effective and not toxic. But for the azole antifungals, we need to keep a really close eye on the levels and make sure that we've got the right dose for the right patient. So there's lots of different things that can affect the level of the drug. So absorption, so if you're absorbing the drug very well, your level may be high. If you're not absorbing the drug, so if you've got some problems with your bowel or some other drugs that may affect the absorption of the drug, then that can affect the level. Food, so some drugs should be taken with food and some should be taken on an empty stomach. So that'll be on the box and you should be counselled on whether you need to take it with food or on an empty stomach. For some drugs, it doesn't matter, but some it is quite specific as to when they need to be taken. So the drugs are broken down by the liver to be excreted. So because of differences in the way that different people's livers work, different people can metabolize these drugs differently. So different people need different doses of the drug because some people may clear it faster than others. Other medicines may impact on the levels of the drug. So I'll talk more about drug interactions later on. So as you can see, dosing needs to be individualized for that specific patient. And we will do, so it's blood tests that we'll do whenever we start you on an azole, and whenever we adjust your dose, we just need to check the level just to make sure that you're on the right dose for you. So side effects, because fungal cells are quite similar to human cells, there is quite a lot of side effects because the antifungals can also impact on human cells as well as the fungal cell. So for the azoles, they can cause problems with your liver, but we will always monitor this whilst on treatment. And it's particularly a problem if your level is too high. You can end up getting liver toxicity. So whenever you get your level done, we will always ask that your GP does your routine safety bloods at the same time, so checks your liver and kidney function. So when you're getting your levels done, you should make sure that the GP is also doing your routine safety bloods for you. The azoles can also cause some damage to the nerves in your hands and feet, and this is what we call peripheral neuropathy. So you may get symptoms of pins and needles and numbness in your hands and feet. And if you are on an azole and you start to experience these side effects, you should contact the centre and let us know, and we may review whether you need to come off the antifungal or whether we just need to monitor you a bit more closely. It does happen with all of the azoles. It can happen, but just because you've had it with one azole doesn't mean you'll definitely have it with another. So we may try another azole, but we would always monitor you carefully if you've ever had any signs of peripheral neuropathy. They can cause QTC prolongation, all of them apart from isavuconazole, which actually shortens it. So the QTC interval is the period of time between your heart contracting and relaxing when it's beating. And if this becomes prolonged, then that can cause the heart to go into an abnormal rhythm, which can be quite dangerous. So we will always, before we start you on any azole, we'll do an ECG just to check whether your QTC is already prolonged. If you're on other drugs or have other risk factors for QTC prolongation, then we'll do ECG monitoring after you've started therapy. So they're the sort of, this isn't a full list of side effects, but they're some of the main ones that are that can happen with all of the azoles. Some sort of drug-specific ones, so itraconazole can cause fluid retention and swelling and can put you at risk of heart failure. Can also cause high blood pressure and adrenal suppression, which we will always monitor you for all of these side effects. Voriconazole can cause photosensitivity and visual side effects. So photosensitivity is when your skin becomes very sensitive to sunlight, which can cause burning, and it has been linked with skin cancer. So we'll always advise you to wear a high factor sun cream. Posaconazole is can also cause fluid retention, high blood pressure, and adrenal insufficiency. So the IV antifungals, so the echinocandins can cause a low calcium and magnesium and problems with your liver. So if you do need to have IV antifungals, we will always monitor your blood tests whilst you're on them. Ambisome, so ambisome can cause damage to the kidneys. So the drug, as well as affecting fungal cells, can also bind to the cholesterol in the kidneys. It has been formulated to try and reduce that damage, but we'll always need to make sure we monitor your kidneys if you're needing to have any ambisome therapy. And it's important to maintain hydration during treatment to protect the kidneys. It can also cause your potassium and sodium to become low, so we'll always monitor that. And it can cause infusion reactions, so some hypersensitivity reactions. Usually this can be managed with paracetamol and antihistamines, and it can be managed by slowing down the infusion and giving it over a longer period of time. So nebulized amphotericin for ABPA and SAFs can cause bronchospasm and chest tightness. So before starting any nebulized antifungals, you would always have a test dose with our physiotherapists who would be able to make sure that it would be safe for you to use this. So as you can see, there's a lot of potential side effects to antifungal therapy. So it's always important that we do a risk versus benefit analysis to make sure that the risk of antifungal treatment doesn't outweigh the benefits that it's going to give to the patient, because we don't want to be giving someone something that's not going to give them any benefit and is just going to cause dangerous side effects. So that it's really important to monitor you very closely whilst you're on antifungal therapy. So now moving on to drug interactions. So it's mainly the azoles, antifungals that have a lot of drug interactions. So the azole antifungals inhibit the drug metabolizing enzymes, which are involved in breaking down a lot of different drugs. So by inhibiting those enzymes, the concentration, that should say increasing, not reducing. So by inhibiting the metabolizing enzymes, it can increase the concentration of any drug that's broken down by those enzymes. So some drugs can also increase or decrease the metabolism of the azoles themselves, because they're also metabolized by these enzymes. So it's very important to make sure that your doctor is aware of absolutely all of the medication that you take. So your GP needs to know that you're on an antifungal as well. And it's important that if you're starting or stopping any medicines, that you make sure that they're not going to be adversely affected by the antifungal. So absorption, so certain drugs may reduce the absorption of other drugs. So an example of that, omeprazole can decrease the absorption of itraconazole, and that's because itraconazole needs an acidic environment for the capsules to open and to be absorbed. So if omeprazole reduces that, then it can reduce the absorption of itraconazole. Some drugs may bind to other drugs as well, which can cause drug-drug interactions. Another, so not specifically a drug-drug interaction, but if you give two drugs that have the same side effects, then you can get an additive increased risk of side effects. So with the azoles, if you're giving multiple drugs, or any of the antifungals, if you're giving multiple drugs that can cause damage to the liver, that increases the risk of liver toxicity. If with ambisome, you're giving drugs that can also affect the kidneys, that increases your risk of kidney toxicity. If you're giving multiple drugs that can prolong the QTC interval, then that increases the risk of that prolonging and will need much closer monitoring. Not just drugs, but some fruit juices can also interact with antifungals. So the grapefruit juice can inhibit the metabolism of some of the azoles. But it's not all fruit juices, so mainly grapefruit juice and pomegranate juice also can. Acidic juices such as orange juice can help to aid the absorption of itraconazole capsules. So sometimes it's beneficial to have that interaction. We have a very useful website which has been put together by the Fungal Infection Trust to look up antifungal drug interactions, and this can be used by clinicians and patients. So if you click on that, you can search which drug you're on and then check whether it interacts with any of the antifungals. But the main important thing about drug-drug interactions is just to make sure that your clinician's aware of absolutely all medication that you're on. And if you're going to start on anything new, just to check that it doesn't interact with your antifungal therapy. And it may be that with the interactions we can manage with dose adjustments. We may need to monitor your drug level more closely whilst you're on a medication. Also, if you stop a medication that's potentially affecting the antifungal, we may need to adjust the dose again. So it's just important when starting and stopping any new medication to make sure that there's no problems with your antifungal therapy. And also one thing that can make it quite complicated to treat Aspergillosis is when patients have drug resistance. So Aspergillus can develop resistance to a drug, and basically it develops mechanisms to survive and continue to grow even when it's exposed to the antifungal. So there's different ways it can become resistant. So it can become resistant through exposure to the drug. So if you have low levels of the drug in the body that isn't effective to kill the bug, it can then lead to resistance. With CPA, the volume of fungus in the lung can sometimes, because it's so big, the drug isn't ever going to get rid of all of that. So in Aspergillomas in particular, we do see the development of resistance to the azoles. You can also have environmental resistance, and this is due to the use of azoles as pesticides. And some species of Aspergillus are just naturally resistant to some of the drugs that we have available. So we can detect the resistance from sputum samples, and we may need to change therapy depending on the resistance pattern of the Aspergillus. So it's just because it's resistant to one azole doesn't mean it'll be resistant to all of them. Sometimes it retains activity for one of the azole over some of the others, but sometimes it may be resistant to all of them, and that is when we may need to start using IV therapy if that's indicated. So to prevent drug resistance, it's really important that we use antifungals appropriately, and this is a term that we call antifungal stewardship, and that's about making sure that we use the right drug at the right dose at the right time for the right patient when it's likely to be most effective. Okay. So that was an overview of the complications and complexities of antifungal therapy.